I am guessing we're about ready to start. Can somebody just give me a high sign if we've got everything connected? Great, looks connected. Let us get started. Welcome, everybody. Sorry, we're starting a couple minutes late. We had minor technical difficulties, sign of the times, it happens, but we are happy to be here and we are happy to have you here with us. Thank you for attending this really important discussion about the COVID-19 vaccines. My name is Kate Shindle. I'm the moderator for today's webinar and the president of Actors Equity Association, the labor union representing more than 51,000 stage managers and actors working in live theater across America. I want to welcome our equity members as well as members of our co-sponsoring organizations, the American Guild of Musical Artists, the American Guild of Variety Artists, the Guild of Italian American Actors, and the Department for Professional Employees, as well as everyone else who is watching today's event. We begin every equity event with the preface to our code of conduct, so I will go to that now. Actors Equity Association is committed to providing a respectful environment free of discrimination and harassment, regardless of an individual's race, religion, color, sex, age, national origin, sexual orientation, disability, gender, identity, or expression, ancestry, pregnancy, or any other characteristic prohibited by law. Because the union expects participants in its activities, events, and meetings to respect one another and to recognize and value individual differences, Actors Equity Association will not tolerate discriminatory, harassing, disrespectful, or otherwise unacceptable behavior at any of its activities, events, or meetings. It adopts the following code of conduct and expects those who participate in any of its activities, events, or meetings to abide by it. In addition to this code of conduct, Actors Equity Association has an anti-discrimination and anti-harassment policy and complaint procedure, which covers staff employees of the union. This code of conduct is not intended to replace or amend that staff policy. So now to the reason that we are here. Theater, as we all know, makes up a critical component of our society and is an essential piece of our nation's economy in communities large and small all over the country. To safely and swiftly reopen live theaters, though, we need to ensure that actors and stage managers and other theatrical professionals have the necessary information to make informed decisions about getting their COVID-19 vaccines. Many of you have cared for those with COVID-19, have seen family members sickened, or have gotten sick yourself. The COVID-19 vaccines could have an incredible impact on your lives, and that is why we are here today. With 3 COVID-19 vaccines already authorized for use and more in the pipeline, it's an important time for transparency and a critical time for understanding not only the development process, but also safety, efficacy, and equitable distribution. Each and every one of us will need to make individual decisions regarding vaccination based on the best information available. We all know how important it is right now to be sharing information and answering questions about the recent development, approval, and allocation of the COVID vaccines. So today's webinar is specifically a chance to learn more about the vaccines themselves from medical experts working in the field. Questions equity members have about how vaccines affect going back to work will be answered at our town hall tomorrow. So for now, we are excited to hear directly from and have a dialogue with some of the leading experts on the COVID-19 vaccine and its distribution process. We are joined today by Dr. Peter Marks, the director of the Center for Biologics Evaluation and Research, CDR, at the Food and Drug Administration, FDA, which is the agency responsible for regulating and reviewing the safety and efficacy of COVID-19 vaccine candidates. Dr. David Fitter is a medical epidemiologist who serves as the branch chief with the Immunization Systems Branch within the Global Immunization Division at the Centers for Global Health at the Centers for Disease Control and Prevention. He has served multiple rotations as a co-lead for the Vaccine Task Force in CDC's COVID-19 response. And Dr. Mrna Dawson serves as the president and CEO of the National Black Nurses Association and as an associate professor and scholar at the University of Alabama at Birmingham School of Nursing. Her work expanding vaccine accessibility has been used as the model that CDC is using with COVID-19. So thank you all so much for being here. I'd now like to give our speakers a chance to make some opening remarks, and then we will get to the questions that you have submitted. So I think we're going to go to Dr. Marks first. I'm pleased to introduce him. He will walk us briefly through the clinical trial process for vaccines and review some information on the safety and efficacy of the COVID-19 vaccines. Dr. Marks, over to you.
Thanks very much. Thanks for having me today and for listening. So I'm just going to quickly tell people, I think one of the questions that comes up often is how did we end up with COVID-19 vaccines so quickly when vaccines normally take several years to develop? And it's important to understand that much of vaccine development is a stop and start process often, where one waits between getting certain results before proceeding on to move forward in development. And that means that there's a lot of dead time, space when not a lot is going on. In addition, one usually waits till one has an effective vaccine before one really scales up and manufactures a lot of that vaccine to use in people. What was done in the case of the COVID-19 vaccines is all of the dead space in development. In other words, all of the intermissions were removed. Okay, no between act intermissions. Sorry, the phases of development were collapsed, but no corners were cut. And at the same time, rather than waiting till the very end of the process to start scaling up manufacturing, that was done at risk during the process. So that has brought us in really less than a year's time, 3 vaccines that are currently available for emergency use. Now, emergency use authorization is a term that we use for products that are they're not fully approved, that's true. But in the case of the emergency use authorized vaccines in the United States, we at FDA put out some guidance earlier on that explained to the public that we would hold these to a pretty high standard. And so the standard that we've held these vaccines to is quite close to that for an approved vaccine. They have demonstrated their effectiveness in large, randomized controlled trials, such as we would use for normal vaccines that we would approve otherwise, trials that involve tens of thousands of people, ranging from 30 to 45,000 people of a diverse nature. In other words, the trials, all of the different trials had roughly 10% individuals who were African American or characterized themselves as Black or African American, and about a quarter that characterized themselves as Latinx. About a third of the people, 20% to a third in each of the trials, were over the age of 65. So a fairly good representative sample of people in these trials, and that has led to us being able to authorize these trials with reasonable confidence that they are going to be effective. The effectiveness of 2 of the vaccines, the Moderna and Pfizer mRNA vaccine, those we had authorized in December. They were in the mid-90s, and the efficacy of the Janssen vaccine in the United States was about 75% against 74% against moderate to severe COVID-19. But if you look at all of the vaccines, all 3 of the vaccines are very similar in that they all prevent death and hospitalization from COVID-19 equally well. There are some benefits, the benefit to a 1-dose regimen of the Janssen is your one and done, as even the president has said, whereas the others are 2-dose regimens. The second dose of both of these vaccines, of the Moderna and Pfizer vaccines, tend to be associated with a bit more side effects than the Janssen vaccine in terms of feeling tired or flu-like. Again, those are essentially transient. Those are symptoms that go away generally after 1 to 2 days, but some people get more disturbed by that than others. I would say the following: that if you do, when you do get vaccinated, and this I'll close with this, when you do get vaccinated, particularly if you're getting the 2-dose regimens, after your second dose, I would not plan on doing a whole lot for the next day. that you can't take it easy from. So we're very lucky to have 3 very safe and effective vaccines here. They've met our EUA criteria, and I think any one of them I'd be happy to take. We'll continue to look at future vaccines, but right now the most important thing from our perspective is that people get any one of these vaccines so that we can get back to life as more normal in the United States and the globe. Thanks.
Thanks, Dr. Marks. I have 1,000 questions about the artwork behind you, in addition to the vaccine efficacy, but I think that people are primarily here to hear about vaccines, and that was really informative and helpful. Thank you. I want to move over to Dr. Fitter, who will provide an overview of the CDC's COVID-19 vaccine task force and its work to protect our nation's health and ensure state and local public health partners have the resources, guidance, and scientific expertise to respond. Dr. Fitter?
Thank you so much. And like Dr. Marks says, thank you for having me today. So I think you all know, you got my background already. I've been with the vaccine task force for the past several months. And then, I think one of the pieces that I wanted to address first is, we really appreciate having these opportunities to talk with groups about what's going on with regards to the COVID response and in specific areas in the COVID response around vaccination as well. So thank you for inviting us. As Dr. Marks said, in less than a year, multiple COVID-19 vaccines have been developed, put through clinical trials where they were tested for safety and efficacy, manufactured, and are now being distributed and administered throughout the United States and territories. So we currently have the 3 COVID vaccines that have been authorized for emergency use authorization by the FDA and that are recommended by the CDC. So it's the Pfizer, Moderna, and Johnson & Johnson, or Janssen. I always pronounce that one incorrectly. And each vaccine is really effective at preventing serious illness, hospitalization, and death from COVID-19. Also, just last week, a CDC study reviewing data from the first 3 months of vaccinations amongst healthcare personnel, first responders, and other frontline and essential workers found that the Moderna and Pfizer vaccines were 90% effective in preventing COVID-19 infection 2 or more weeks after full vaccination. So this finding really demonstrates the high real-world effectiveness of these vaccines. So CDC and the USG are leveraging long-standing relationships with US state, local, tribal, and territorial health departments and other partners, including those within the federal government and the private sector as well, to coordinate the distribution and administration of COVID-19 vaccines quickly, safely, and equitably. And I'm strongly encouraged by the progress that's being made. We knew that there would be a few bumps in the road as the COVID-19 vaccine program was rolled out. However, public health experts from across the country have extensive experience with vaccine distribution and administration and are working quickly to overcome any obstacles. And daily vaccine doses administered continue to rise, with more and more doses administered each day. Currently, we're looking at about 2.7 million doses are being administered every day. And so as of yesterday, almost 170 million doses have been administered across the United States and territories, with more than 108 million people receiving at least 1 dose. So right after the initial COVID-19 vaccines were authorized, sorry, my light went out. So right after they were initially authorized by the FDA under the EUA, or Emergency Use Authorization, in December of 2020, CDC's Independent Advisory Committee on Immunization Practices, also known as ACIP, identified groups to receive the initial doses of vaccine while supply was limited. These groups included healthcare personnel and long-term care facility residents, like in nursing homes, in the phase 1A. And then frontline essential workers and adults 75 years and older were in phase 1B. And the remaining essential workers were adults 65 to 74 years old and 16 to 64-year-olds with high-risk medical conditions in 1C. So these recommendations ensure that people at the highest risk from COVID-19 are vaccinated, in addition to being equitable and fair around vaccine distribution. I want to reinforce that while ACIP and CDC make national vaccine recommendations, each state has its own plan for prioritizing which groups will be vaccinated first. We fully expect that there would be local adaptations. So our guidelines were never intended to be walls or barriers or strict guides, but the intent with them was to support prioritization while vaccine supply is limited. And we expect that there will be overlap between vaccine phases as well, and some difference from state to state. And this is exactly what we have seen as the rollout has progressed. So now we're almost 4 months into the COVID-19 vaccination program, and states are in different phases of vaccine administration as the supply continues to increase. Many states have expanded groups recommended to get vaccine and fully sort of open to all phases. So I believe we're at 35 states that have done that. This includes all age groups and frontline essential workers as well. So that's 16 and over population. And many states have announced that they are projecting to expand their eligibility to everyone over 16 years of age before what the administration has asked for. So as I just said, most have already gotten there and many are doing it in the coming weeks as well. So as I've discussed, multiple partners are involved with this, as is the population as a whole in partner groups. So successful implementation of COVID-19 vaccine requires this multi-phase plan with distinct strategies to deliver vaccines efficiently and equitably as more doses become available. So one such strategy is CDC's partnerships with chain and independent pharmacies, as well as with federally qualified health centers to increase access to vaccine in communities. So the Federal Retail Pharmacy Program, or FRPP, for COVID-19 vaccine is a public-private partnership that involves 21 national pharmacy partners and independent pharmacy networks representing over 40,000 retail and long-term care pharmacy locations nationwide. And the goal is to have all 40,000 store locations in the program's network activated by April 19th, ensuring that 90% of Americans have vaccine access through a community program that's within 5 miles of their home. The Health Center COVID-19 vaccine program is a partnership with the Health Resources and Services Administration, or HRSA, and CDC, and is underway at select HRSA-funded health centers that specialize in caring for hard-to-reach and disproportionately affected populations. So the goal is to address health equity in vaccine delivery by providing a direct supply of COVID-19 vaccines to health centers who serve these populations, such as people experiencing homelessness, public housing residents, patients with limited English proficiency, low income and minority patients, and rural and frontier populations. Lastly, I also want to address the Federal Emergency Management Agency, or FEMA, is working really closely with CDC and other federal agencies to coordinate with states, tribes, territories, and private sector partners to increase vaccination in the US. So this includes coordination efforts to establish and support fixed facilities and establishing also pop-up or temporary vaccination sites and mobile vaccine clinics. And FEMA is currently supporting nearly 900 community vaccination centers nationwide. So to learn what's available in your community, you can contact your state and local health department or discuss with your personal healthcare provider. The other thing that I would like to sort of introduce everybody to, if you don't already know it, is Vaccinefinder.org, which is a free online service where users can search for pharmacies and providers that offer vaccines in their communities. So it's an exciting and historic time. You guys have probably heard that a lot. And there are many activities that are happening, but the work is not over yet. It will take time to vaccinate all people in the US. I know that you, like so many others, are eager to get back to work and to have a more normal life. The more people who choose to get vaccinated, the faster we can get there. It often comes up which vaccine is the best. And I think sort of Dr. Marks was alluding to this as well. The best vaccine is the one that's available to you. So really encourage folks to get vaccinated. And somebody looked this up for me because I missed my tickets to Hamilton, unfortunately, because it was closed. But in the words of Alexander Hamilton, I hope you won't throw away your shot. This is a whole of society effort. So I really encourage everyone to carry the message of importance around COVID-19 vaccination and how to protect yourselves, your coworkers, your friends, and your family as well. CDC has many resources available on its website to help you stay informed about COVID-19 vaccines and around other issues regarding COVID. We also have communication toolkits, social media content, and information on what to expect at your vaccine appointment, to name a few. So I'm going to reiterate a point. Vaccine is a really important, but it is a tool in our toolkit to help us combat the COVID-19 pandemic. And so do keep in mind the other preventive tools that are there, and it really is important to prevent the spread of COVID. So in combination with getting vaccinating and following other efforts, I really hope that together we can get to the end of this pandemic. So thanks for the opportunity again, and look forward to talking some more.
Thank you so much, Dr. Fitter. Yeah, no event is complete without someone quoting Hamilton. So you checked that box today. Thank you. I'd like to introduce next Dr. Dawson, who's going to share an overview of the process taking place to distribute the COVID-19 vaccines and discuss some of the challenges and opportunities facing diverse communities in achieving equitable access to the vaccine. Dr. Dawson?
Okay, thank you for having me today. And I think this is a very important opportunity to inform the public. Because one of the things, if we want people to get vaccinated, is they have to have an understanding, and they need very clear information. So as was just stated by Dr. Fitter, is that when the CDC and others started pushing out the guidelines relating to how the vaccination was going to be distributed, they did, kind of turn that over to the state with just general guidelines. Then each state kind of went down to the next level of explaining how they were going to do this. And of course, most of us are aware that we started off trying to get to those essential healthcare workers, the nurses, the physicians, the pharmacists, the respiratory therapists, those individuals that were providing care to patients once they really started having negative responses to COVID. And that was important because we want the individuals who are taking care of us to be able to take care of us safely. And so then after that, they started, looking at other, what they call essential workers. That might have been some of those in grocery stores, some of those who were actually, driving food, taking food and transporting, medical equipment and other things. So thinking about this from a big picture and trying to bring it down to a narrow picture. Now what we've been able to do is to say that we've had so many people vaccinated that are already in that healthcare space that now we're trying to push it out to the rest of the public. And I would say that your organization and your members that you represent are also an essential part of our society. For one reason is because you all give us that relief from the mental health break that we need. And so we need for you all to be vaccinated as well. And so again, you can find out by just going to, your health department and other things online to find out where can you get vaccinated, within your community. And I will tell you, all of your major university, if you're near something like a Emory or a Yale or a Morehouse or Drew University or UCLA, all of those major universities are either they have the vaccination ready for you, or they can tell you where to go. Check with your public health department as well. Has there been some obstacles and barriers along the way? Yes. When you're trying to do something this large, you're going to have some problems. So for example, for many of my members, when I was checking around the country, and the National Black Nursing Association, we have 113 chapters and 35 states plus DC. So we're large. And the good thing about us is that we did not show up because of COVID. We was already out there encouraging people to get the immunization, whether we was talking about making sure that your children got immunized, or if we were talking to our most senior adults, or, get your pneumococcus vaccine, get the shingles vaccine if you need to have those, try to get your flu vaccination every year. So we were already in the community, so we weren't a new present there. And so when you're talking about trying to get people better educated and move them from what someone call hesitancy, and I say all the way from hesitancy to readiness, meaning they're ready to listen to information, sound information, and we can help dispel some of the disinformation they may have heard and misinformation they've heard. And then our next step is to then get them to the acceptance phase where they're saying, okay, I can accept the science. I understand the science better. I feel that I'm in a comfortable place for making a sound decision. And then our next goal is to move them to action, where to get that shot in the arm. And that takes trusted individuals, people that they have a relationship with. So we are very comfortable going into faith-based organization. We love to partner with others, whether we are partnering with the Urban League, we may be the Red Cross, the NAACP, local politicians, again, other nursing associations even, so that we can get the message out to people. And what I found is that people are comfortable if you can answer their questions. And if you don't know the answer, to say, I don't know, but I can get back with you. Because what people want is they want you to be real. They want you to give them the information where they can understand it, allow them to make the decision. So we're not out there to persuade, we're out there to educate. But then once we educate and it's time to vaccinate, we have to make sure that the supply is where the supplies need to be. And yes, again, I've heard from different states where it's time to get vaccinated and you got 1,000 people showing up and there's 100 vaccines. We don't want that to happen, because then you have to almost start back over building that trust level again. And trust is so essential when we're talking about these things. And I love to educate because I've been in nursing for a long time. And then I was a young chief nursing officer and VP of clinical operations during the flu pandemic. And we actually started doing the drive-through flu vaccination when I was at the University of Louisville. And the young PhD person that was on my faculty, that was about quality and safety for patients, she came up with this concept, why don't we implement this? They were already doing it globally, but we were the first hospital in the United States to do this. And we found that just having people drive through, stick their arm out the window, vaccinate them was so convenient. And if you had 2 people in the car, you can do them both at the same time. So I think history has brought us full circle that we were prepared somewhat for this. But the other thing that I tried to answer sometime and one of our prior speakers spoke to this, is when people say, well, how come this vaccine was developed so early? I love to just speak to people at their own level. And I say, okay, did you really take a good look at Dr. Fauci? He did not just wake up when COVID appeared and decided, I'm going into the lab today and we're going to come up with a solution for COVID. This is their occupation. They've been doing this for years. And they already had a learning curve from other things. Now, many people are too young to remember HIV, but I was a young nurse at the bedside when we first had to start dealing with HIV. And I can tell you, a lot of the things that we're using today came about because of innovation during HIV. All of the things when you hear us talking about the PPEs, the shields that we have for our face, the masks that we're using, all of those things really came about during that era. You know, safety needle disposable boxes. I can remember as a young nurse, we didn't have the disposable boxes. We were using Coca-Cola bottles, you know, to put the wasted, the bad needles into, the used needles, that is. So there's so much that we've learned along the way. But one of the things I like to, when people say, but what about the speed? Again, during our era of HIV, one of the things that we learned very quickly is that it could be passed by any type of body fluid, you know. And so again, we had to learn to protect. And one of the things that we really had to do very quickly was, how did we detect HIV and AIDS in our blood product? Because that is such an essential thing. We did not wait 8 years or 10 or 12 years to come up with that solution. We had to do it immediately because it was, again, a public health crisis, just like COVID. So we've had to respond quickly, and we've had a lot of collaboration across pharmaceutical company with research institution at these major universities. And I think now we're in a safer place, and we just need people to trust us and to move forward. Thank you.
Thank you so much, Dr. Dawson. So we had a lot of questions submitted. we have about 20 minutes left. We will try to get to as many of them as possible. Hopefully all, but there are a lot of questions. So I want to just start by asking everyone on the panel if you and your family members have received the COVID-19 vaccine, or if they are prepared to when it is available to them. Do we want to go to Dr. Marks first?
Yeah, so thanks. So I was finished getting vaccinated about a month ago with the COVID-19 vaccine. My wife is halfway vaccinated, and my kids both have, we're adult kids, both have appointments. We're lucky enough to live in the District of Columbia, where they are pretty broadly vaccinating right now.
Great, thank you. Dr. Fitter?
I am, like Dr. Marks, about a month out from being fully vaccinated. My family is very much getting vaccinated. In fact, I had multiple text messages from my mother starting in about January, mid-January, asking me where she's going to get vaccinated. Mind you, I live in Georgia and she lives in Pennsylvania. It kept me in very close contact with my mom, but she is now fully vaccinated, for those that are concerned.
I mean, if your kid works at the CDC, you probably figure you've got the N, right? And Dr. Dawson.
Yes, I completed my second dose March the 11th. I took the Pfizer vaccination, and my family, they either have had their first shot or they're getting their second. And what I would just like to say is, I know a lot of people ask about, well, what about the side effects? I absolutely had no side effects. I had a little sore arm with the first one. The second one, my arm wasn't even so. And I built myself up for the chills and the fevers and all of the things people said I was going to have, and I didn't have it. So immediately after I received the vaccination, I went for a short walk. You know, that night I went to bed and I said, okay, I'm going to go to bed, wake up in the morning, and it's going to hit me. Nothing at all. I really think it almost made me feel better.
That's great. I got my first dose on Monday of Pfizer, and I felt a little bit off yesterday, but nothing that made me cancel a meeting. Nothing that I wouldn't put up with to get back to work as soon as possible, right? Okay, now we're going to get to the questions, which cover a wide variety of issues around development, safety, efficacy, and equitable distribution of the vaccines. Questions were submitted by our audience members prior to the start of this event. So we're going to go to Dr. Marks first. Attendees are interested in learning more about the development process and effectiveness of the vaccine. So first, can you quickly clarify the difference between emergency use authorization and full FDA licensed approvals with these vaccines? Does the shortened process give us enough time to know about possible long-term side effects and safety?
Sorry about that. The good
That's
news
okay.
here is that the efficacy determinations of these vaccine, I think we're feeling pretty comfortable with. The size population was very similar to the size of an efficacy population for any other licensed vaccine. Obviously, the safety follow-up at the time these vaccines were originally deployed was not as long as it would be for a normal licensed vaccine. And that's why we have very good safety surveillance systems in place that actually are an overlapping array of systems from CDC and FDA, which include both passive systems, those in which people report adverse events, and active systems that where we go looking for adverse events in claims databases and in electronic health records. And the good news is that what we've seen so far have been no major safety signals of concern. We did early on learn that there was a small risk, about 1 in 250,000 to 1 in 500,000 risk of allergic reactions, severe allergic reactions that we now know how to deal with and why we were prepared to deal with them. And that shows the system's working, the fact that we found these, and we'll continue to look for them. But in terms of the difference between this and a licensed vaccine, the key thing here really is the submission of what would be a biologics license application, which takes time to submit, and some of the manufacturing information that would go with that would take time for us to review. So I'm pretty comfortable saying to people that, you know, if the floor were your average garden variety emergency use authorization and the ceiling were a biologics license application, a fully approved vaccine, we're pretty close to like a chandelier hanging just a little bit off the ceiling. We're pretty close.
Okay. Do you know, can you tell us how long a vaccine is expected to provide protection for? For example, is it more effective than a flu shot?
Yeah, so let's kind of unpack that to two different things. So first of all of these vaccines so far, in terms of vaccine, tend to be more effective than your average flu shot. Flu vaccine really only reduces overall influenza by about 60% on a good year and 30 to 50% on kind of your average years in the overall population. Obviously, it can be different in different age groups. So these are really, for vaccines, these are good vaccines, okay? We don't know exactly how long these will protect for. We know that at least for 6 months, people appear to be well protected with the Pfizer and Mrna vaccines. It could be that when we follow people longer, it's possible that people will need boosters after a period of time. Could it be a year? Possibly, but we still are going to have to get more data to know that. But for right now, the important thing is, listen, at least 6 months is what we need to try to climb out of this pandemic, and hopefully it'll be more like a year.
Thank you. Our next question for you is, can you help explain to non-doctors the mRNA protein that's used in the Pfizer and Moderna vaccines? Specifically, can you speak to whether there's any truth to the claim made by some that it could lead to autoimmune or other health issues over time?
So let me just explain. All of these vaccines are ultimately producing a protein that the body then recognizes as foreign and develops an immune response to. And it's how you get to that protein that is a little different. So for the mRNA vaccines, mRNA is the messenger that translates what's in your genetic material, your DNA, into protein. And so what it's doing is just giving a small amount of that. That gets into some of the cells, the muscle or other cells, and it leads to the production of this protein, which then appears on the surface of the cells. The body recognizes that protein as foreign. Within a day or two, that mRNA is gone. Your body has then been exposed to the protein and develops an immune response. And that immune response goes on to protect you for months and months afterwards. The Janssen vaccine is based on a relatively harmless virus that goes in. The virus's DNA produces ultimately mRNA, which the same mRNA which goes on to produce protein, which does the same thing. And ultimately, we may even see, these are still not under emergency use authorization, we may see in the future just simply giving the protein to make the same thing happen. There's no evidence right now that we don't have any evidence to suggest that giving these vaccines triggers off autoimmunity, these mRNA vaccines. The other things, just because we hear about them all the time, might as well as a bonus prize for asking this question, these mRNA vaccines are not associated with infertility. There was a concern, somebody raised the question of could they be like some messenger RNA that's present in the reproductive system. They're not. And there's no evidence whatsoever of that. In fact, they've been studied in reproductive toxicology studies and shown to have no adverse effect. So as I say, we will continue to monitor for anything that comes up, and that's our job. That's what we do. But so far, they have a pretty clean safety profile.
Okay, thank you. We also received a number of questions, a variety of questions asking about the new strain of COVID-19. And this is also for Dr. Marks. Obviously, there are now different strains. What does this mean for the vaccine? And how does the vaccine protect us if strains are always mutating?
Yeah, really great question. So it turns out that the issue with this particular virus is that most of what's on its surface is called the spike protein. The spike protein turns out to be this really big protein. It's actually 3 proteins twisted across that kind of have a head part and then a stalk part. And unfortunately, around the head, it seems to tend to have these mutations that are occurring, which can reduce the ability of some of the antibodies that we make to clear the virus. Luckily, with the current generations of vaccines, so far, all of the evidence, both in the laboratory and in some cases on the ground in studies that have been done, say that there's enough ability of the antibodies against the stalk, my arms as opposed to my hands, that are able to neutralize the virus, so that so far we're doing pretty well with the Moderna, Pfizer, and Janssen vaccines against the variants that we know are circulating in the United States. So there may come a time when we have to move to some type of booster vaccine that has a different sequence in it, so that we can take care of how the protein is changed on the virus. But right now, it looks like we're okay with the existing vaccines that are deployed. And obviously, our colleagues at the Centers for Disease Control and Prevention, along with FDA and other partners, will be watching very closely to make sure that these variants don't come up that escape the current vaccines.
Okay, thank you. We also received a couple questions on adverse events, and Dr. Fitter can jump in here as well. Actually, Dr. Marks, you answered one of them already in a previous answer, so thank you for that. But this one is about why some people are having different side effects. Why would some people get full-on fevers and nausea from the vaccine while others are just having mild shoulder pain from the shot itself?
I can start by taking a stab at this, and then, or I should say a jab since the shot. But then Dr. Fitter can, you'll know you don't want to hire us as actors ever with my bad comedy. The issue is each of us at any given time has our own unique genetic makeup. We also have the recent environmental factors that we've been exposed to. We also have our own innate immunity, and there's probably some combination of that that leads us, when we get an injection, to have a different reaction. The reaction that one has is very much like the reaction one has when one gets a virus. One makes certain immune substances that the body makes to try to wipe out and eliminate an invading organism. So you get some of that. The technical term is a cytokine response. It's basically makes you feel fluey and achy. And why some people get it and other people don't probably have to do with the robustness of the immune response. It's why younger people, people under the age of 50, tend to see more of this than older people. Because they tend to make more robust immune responses. But like many things in the drug world, we don't fully understand why some people have more. So they probably have some mix of genetics and recent exposures and your natural immunity, but some of it does end up being hand waving, because we see that with all drugs, that some people have no effect whatsoever to a particular drug and others have a very significant one. Dr. Fitter, you want to add to that?
Dr. Marks, I think you hit the nail on the head on this one. I think one of the things that I wanted to reinforce, and Dr. Marks had said it earlier, is that we have such a robust safety system in place in the United States monitoring the vaccine, and that the safety profile is very good for these vaccines. And the FDA, there goes my light again. I can't time this well enough. The FDA keeps all this in consideration, as does ACIP, when looking at the vaccines, and we continue to monitor it going forward. So one of the things we have passive surveillance, sort of people reporting in things that are happening. We also have active surveillance, people, and this is like the V-safe, which anybody that's gotten vaccinated will see, to sort of trigger a response from somebody to say, how are you doing today? How is it going? And so do keep that in mind, and that we're watching very closely.
Thank you. So we also got a number of questions about who needs to be vaccinated, what happens after vaccination. I'm going to combine a couple of them. is there anyone who should not get the vaccine? Specifically, we received questions about people who have already had COVID. If they already had it, do they still need the vaccine? Children, pregnant people, and people who may be breastfeeding. Question mark.
Yeah, it's question mark. Okay, so let me start with, so obviously we're a little bit, we still would like more knowledge on people who have had COVID in the past. We do recommend in general that people who have had COVID do get vaccinated, but they should talk with their healthcare provider, because the timing of vaccination after they have had COVID may depend on a variety of factors, such as what medicines they may have had to treat the COVID, and also the doctor's benefit risk calculus. And some of that might go into a healthcare provider might know how severe you had COVID or how mild you had COVID, and might feel more comfortable with you getting the vaccination sooner or later. That's a good conversation to have with your healthcare provider. Regarding pregnant women, it's a good conversation to have with your healthcare provider as well, your OBGYN. In general, I can tell you from having had a lot of conversations and having been on various meetings with the American College of Obstetrics and Gynecology, generally most obstetricians and gynecologists are telling women in their second or third trimester of pregnancy to go ahead and get vaccinated, because the risk of COVID-19 to the mother or to the baby is much greater than the risk of the vaccine. And in fact, the fact that we now know that moms that are vaccinated in the second and third trimester, particularly a little bit earlier on, can pass those antibodies along to the newborn. Those are all good things. Just to kind of to do cleanup about anyone else who shouldn't get vaccinated, really, that's a conversation to have with your physician. I think obviously if you've ever had an allergic reaction to one of the vaccine components, you need to tell that to your physician. That would be a reason. But even for people who have some degree of immunocompromise, many, after again having a conversation with your healthcare provider, many healthcare providers will still recommend vaccination, with the caveat to telling people that they may not develop as good an immune response, but still something is better than nothing. And I'll turn this one over again for to Dr. Fitter to do cleanup for what I've missed.
I like that, and cleanup. You hit all the major points. With regards to the pregnancy point, and Dr. Marks again sort of got it. It is a conversation that if there are concerns, it's a conversation to have with your OB-GYN. I think most of the evidence is demonstrating that there shouldn't be side effects associated with it. We do have a lot of information on this on the CDC website as well. I wish I knew the address off the top of my head, but one can use Google or another search engine, COVID vaccine pregnancy, and you'll find it. Again, just reinforcing with regards to the vaccine, looking and making sure that you're not allergic to one of the ingredients in the vaccine. That is on the CDC website. But when you get your vaccine, the provider there should also be asking you around this. If someone had a severe allergic reaction to the first dose of a vaccine, would not recommend getting the second dose of the vaccine. And the providers there should also be telling you this as you follow up with them. So again, it looks like the people on this call would not be on this call if they did want more information, but there's a wealth of information at the CDC website, and I think on the FDA website as well. Sometimes there's too much information, but you should be able to find some of those these points as well there.
Thank you. We haven't heard from Dr. Dawson in a while, so I would like to go to questions for Dr. Dawson. Dr. Dawson, we received some questions on vaccine competence, and you actually addressed the first one, which is calming people's fears in certain communities. But another one of the questions we received is, in terms of equitable distribution, is there any indication that there's only a limited amount of vaccine that is going to be made, and if you don't get one, then you're out of luck?
That's not what I'm hearing at this time. And early on, when they was actually developing the vaccine, I interviewed one of the scientists at Pfizer, and this was probably around about April or May of last year. And one of the things that we discussed was the fact that while the scientists were actually working on developing the vaccine. Well, the other distribution arm of Pfizer was in the process of already gearing up so that they can do mass production. This included making sure that they have the reciprocals that they needed, able to transport the vaccine safely to distribution site. And one of the things that I'm an advisor with the direct relief team. And just last week when we was having one of our meetings, it was amazing that someone have already developed a refrigerator that you can actually connect into someone's cigarette lighter in their car. And this small refrigerator can keep the vaccine at the temperature level that it needs to be kept at. Remember when we first started talking about the distribution of the Pfizer vaccine, that you needed to have these large refrigerators, they had to be subcold, 90 some below zero or something like that. But now to say that you have something that can fit in the back of a van, or at least on a medical van as well. And it can hold up to about maybe 200 vials of the vaccine. So now we're able to get to the rural area with these. So I think, again, that is the innovative and the creative things that have been going on behind the scene to make sure that we can reach everyone. And so now you have these that are not just in the hospitals around the universities, but you have them in the Walmart, you have them in your CVS, your Walgreens. And now with something like this particular small refrigerator, we can use mobile medical vans to get this vaccine out to those rural population.
Hey, I was wondering if I could jump in real fast on this one, and really just to echo some of the sentiments of Dr. Dawson. But the USG is really pushing to try to ensure that there's equitable access to vaccines across the nation. Dr. Dawson, thank you so much for bringing up rural populations. And also, I addressed it quickly, but I recognize I speak really fast, is that trying to make vaccine access close to where people are. So within 5 miles of where they live, we know that access helps drive demand. So people that are thinking about getting vaccine really want to make sure that they can get to a vaccine site. We're also monitoring really closely who is getting the vaccine. And that comes to some of the equitable distribution of vaccine and equitable access. As a public health agency, and Dr. Dawson's group as well, it is our responsibility as well to make sure that populations have access, have information around vaccine, its availability, what happens to those that are getting vaccinated, to help build confidence in their decision-making process so that they can really, hopefully, get vaccinated.
You're absolutely correct, because another population that we have to be very much aware of is the Native American population. So again, those small refrigerators are going to allow people to get into onto the reservations in a different location where they need to be. And I think the other thing that CDC did early on was, I know that a colleague of mine, I have two at least colleagues. One manages the largest federally qualified clinic center in New York, and the other one is in Las Vegas. So when CDC started sending the medication directly to those federally qualified centers, again, that put them right into the communities, into those populations that needed to be reached. And other things that nurses are doing now is we're beginning to also look at going door to door, going back to that old visiting nursing model, where you can actually go into people's home and give the vaccination. So that's already started in some states, and we're getting ready to expand that in other states.
Great, thank you. I want to be respectful of everybody's time. I wish we had more time for questions. I'd like to do just one or two more. And this next one's for Dr. Dawson. I found it really interesting. What would you say to someone who says they don't want the vaccine because they believe their natural immune system is strong enough to combat and survive COVID-19, and that herd immunity should be a natural process?
I'm going to ask them to really step back and begin to do some of their own research and think about things. Currently, COVID is the third leading cause of death in the United States. This is a public health crisis that we only became aware of in around about January the 20th of 2020. And it's already had jumped all the way up the chart to be the third leading cause of death. So you have to ask yourself, do I want to take that risk? And there's something else that I usually try to educate people on, because we hear this, we started hearing this early on. Well, X number of people have recovered from COVID. Well, we're just now getting into what we're calling the long haulers, where people have had COVID long enough for us to understand what are some of the symptoms they have. And, people talking about their hair falling out, they're feeling tired all the time, they're breaking out in rash, So things that we're learning from individuals that have had COVID tells me that I would not want to take the risk of catching COVID. Because there's two things people have to understand. Number one, COVID is not a medical condition. Now, let me explain what I mean by that. It is a public health crisis that if we don't control it and we don't treat it, then for those people that have a very severe negative reaction, those are the ones that end up in the hospitals. They are the ones in the ICUs. They're the ones that we have to put on ventilators. They're the ones that we have to start proming. And they're the ones, unfortunately, many times are not making it. Okay. The second thing is when you hear the word recovered from COVID, they're not saying that you are fully recovered, because we're still learning. Okay. So recovery is not the right word, because I will tell everyone that's had COVID, you now have a pre-existing condition. Just like, even though I took my Pfizer vaccine, I had two pre-existing conditions. I had hypertension, and also I'm a diabetic. Now, I didn't have to take any medication for my diabetes, but I'm on medication for my high blood pressure. Does that medication cure my high blood pressure? No, it treats it. So the more you can avoid catching something or a disease or developing something, the safest and the better you're going to be. But again, like I said earlier, I'm here to educate and help people to find information. And just like Dr. Fitter said, you can find almost everything you need at CDC. And I trust what is there because I know people that have worked there, nurses and physicians. And again, prior to COVID, I knew these individuals. So I would just say, educate yourself well, but ask yourself, if I was a gambler and I had to say, take the vaccine, have the risk of catching COVID, and thinking that herd immunity is going to help me, I would really step back and ask a lot of critical questions of my providers and also other people in the science space.
Thank you. So I appreciate that. I know Dr. Marks has to leave us undoubtedly to go do many, many more educational seminars. I just want to make sure I say thank you and goodbye. It was such a pleasure and a privilege to have you with us, Dr. Marks.
Thank you so much. Take care. Thank you very much.
Thank you. Dr. Fitter, Dr. Dawson, is there anything that you feel like we haven't covered here? I know the biggest question I wanted to ask, and we're sort of out of time, was we keep getting questions about why people need to continue to wear masks after they're vaccinated. So if one of you would like to address that, or you both have something else you'd like to make sure you leave us with, it's your call.
I would say that it is important for us to wear the mask, even after we've been vaccinated. And the reason being is that you have to understand that when I have on a mask, I'm really protecting you. And when you have one, you're protecting me. And although we have spoken about some of the distrust or mistrust and hesitancy or lack of confidence within the Black and Brown communities, we are also seeing reports that there are also Caucasians that are not taking the vaccine at this time. And so if you're not going to take the vaccine at this time, at least protect yourself and protect others. Because unfortunately, even though the vaccine been out for almost 4 months now, we don't have the mass number of deaths that we was having. But I'm still hearing daily from individuals that are having to go into the ICUs, they're on the ventilators. And I've even known people, I won't say I know them personally, but I've heard from other people who have known people personally that even though they've taken the vaccine, Some have elected to travel abroad, and they've come back with the next, variant of this. So we need to be very careful of that. We're trying to move that needle towards safety. We're getting closer, but we're not there yet. It's just like when we're going on a family trip, we covered so many miles, but we still are not at Disney World yet. And that's where we want to get to, is Disney World, okay? And we want to get all of your actors back on stage. We want to see some new movies coming out. We want to see some new plays, and we can't have those things unless we feel safe.
Thank you so much. Yeah, Dr. Fitter.
Dr. Dawson, I do want to get people back on the stage and in the theaters. A couple of points on this. One, just to echo Dr. Dawson's point from the previous questions, I just really want to get home the point that getting vaccinated protects you and protects others. So that is one of the reasons, why getting vaccinated is so important. Secondly, we know a lot about these vaccines as we're studying them going forward. But like COVID, like SARS-CoV-2, the virus that causes COVID, we are learning as this goes forward. So we know that vaccines protect people. We know that getting vaccinated is helpful, but we are still learning transmission dynamics of the virus, even in vaccinated people. So as we get more information, we begin to change some of the recommendations around what people should do and should not do with regards to what we call non-pharmaceutical interventions, including masks. And so for those, I feel like I'm tooting my own horn here, but if you go back, the CDC website keeps updating guidance around those who are fully vaccinated and what recommended activities and what are the non-pharmaceutical interventions like masks that people should be doing, gatherings around this, and these will continue to be updated, and we will try to get that information out to everybody as fast as possible.
Thank you so much. Once again, I want to thank everybody who joined us this afternoon. And obviously, I want to thank our experts for sharing information and fielding questions. This is certainly not the end of this conversation, but it is a really great beginning, which we are happy to be part of. Thank you to our co-sponsors of this event. And if anybody joined partway through, the entire webinar should be able to be viewed shortly. Please just keep an eye on Actors Equity's social media channels, and I'm sure someone will provide us with a link. Thanks so much, everybody. Dr. Fitter, Dr. Dawson, Dr. Marks, it's been a real honor having you here.
Okay, thank you.